Happy Sunday, everybody. Today we're talking about hope for healthcare. We have a physician expert who's here to focus on the solutions of healthcare burnout. We see so much negativity out there. I don't know about you, but it's depressing to see some of the news sometimes, or even social media feeds. And although it is reality, I think what she's trying to do is really change the paradigm of how we discuss it and bring together data-driven resources of how we can solve the issues and not just focus on what's going on. My name is Dr. Elsie Coe. I'm the CEO and founder of Lead Physician Leadership Program for Physicians and the CMO of American Endovascular and Amputation Prevention. If you want to follow any of our videos, we have a lot of free videos. Click on and subscribe, our YouTube page, Lead Physician. And Lead Physician really is about bringing passion, purpose, and potential in physicians. There's so much more potential in physicians than we are given credit for. We even realize ourselves. Now, without further ado, I'd like to introduce to you Dr. Katie Cole. Oh, hi, Katie. How are you?
Hi, Elsie. I'm great.
Thank you so much for being here. Appreciate
Yeah,
it.
pleasure to be
I
here
just want
today.
to show a little bit about who you are first before we get started, if that's okay. Dr. Katie Cole, she's affectionately called the healer's healer, and she's an award-winning holistic psychiatrist, organizational well-being consultant, and change agent. And through her own story, she's brought together this platform she's been very passionate about. She is a graduate of the Lead Physician Leadership Program, and she's put together this Hope for Healthcare platform recently, this podcast, and it's a solution focused podcast highlighting key healthcare leaders and stakeholders on data driven initiatives to resolve burnout, enhance organizational well being, profitability, and the bottom line. And I love what you're doing, Katie. I want to thank you for what you're doing. And the fact that I just want to recognize for this moment that she has helped, save organizations millions of dollars because of how she's developed the right kind of culture, the right kind of processes to really reduce the burnout, get employees engaged in what they're doing. So thank you so much.
Well, thank you for that wonderful introduction, Elsie. And, I just want to give a shout out to you as well. You've been a tremendous coach for me. It's really helped me understand my role and niche in healthcare and helped me actually design and develop the idea of creating this podcast. So thank you.
Oh my gosh. Thank you so much for that. I appreciate it. So Katie, can you help us just for the audience, there's a lot of people here on healthcare listening and not necessarily physicians. How do we as healthcare leaders, how do you help those organizations? Maybe you can give us a story. How did you do that? Maybe some tips and tricks on the short podcast. How can organizations create that kind of not just improving the burnout, getting rid of it, improving the well-being of people, but also maintaining that profitability, because everyone thinks, oh my God, it's going to cost so much money for me to do this.
Oh, exactly, Elsie. And, I have a lot of good news. So if you're in the C-suite, CMO, CEO, CWO, CNO, or whatever, you're listening to this, we have so much data and we have so many statistics and well-being metrics that show financial profitability if you're taking care of the people within your organization. So that's the good news. I want to start out with that. There are multiple resources I think that are very helpful, and I'd be happy to post this in the comment section. One is the National Academy of Medicine has created this roadmap and blueprint for an organization on where to even begin assessing your organization for burnout and turnover and how that is impacting your bottom line. And then ideas of where to begin. There also is the advisory report that just came out recently from the Surgeon General, Dr. Murphy, and it's a 75-page document really outlining what our government is hoping that healthcare organizations look at within their own system and specific tools and ways to turn around burnout and take care of your health system. So there are many different resources out there, and I can talk about a couple of specific ones I think would be very impactful if you'd like me to.
That's absolutely. Thank you so much. Yes.
Well, one of the things that I think can be it doesn't take much of an internal resource to do, but I think having the C-suite shadow the front line can be very effective because number one, it shows that you care. Number two, you're rebuilding trust within the organization. We know that we have some broken trust in our culture of medicine. And also it gives the C-suite an idea of what the front line is going through.
What do you mean by having the C-suite go to the front lines exactly?
Yeah, like maybe, the CEO shadowing a physician or nurse one day a week for a while, just getting a sense of what the obstructions are to patient care, because there are a lot of inefficiencies that are built into the workflow every day that impact productivity of the health system. So that for the CEO to actually understand what is happening on the front line can be very important for the health system.
That's awesome. That's,
Yeah,
I mean, basically understanding what's happening from the bottom up so that
exactly.
you know what you deeply understand, and then helping the employees feel like they're being heard.
Yeah, absolutely. And then even, from the bottom up, sometimes organizations have their frontline staff in terms of leadership development sit in on some of the management meetings. So then they understand too what's happening behind the scenes. So there needs to be transparency across the board.
Okay, great. That's a really good, you know what? I think, my personal experience with my, former and now current boss, he would show up. I remember my former job with American Access Care, he would just show up at the offices, and he deeply understood. He sat side by side with the physicians, even at our meetings, and he deeply understood how the procedures were being done and what were the problems. And I
Mhm.
think that's why we succeeded. So that's a great point.
Absolutely, Elsie.
All
Yes.
right. What else?
Another one that I think can be really helpful is really reducing job demands, looking at your workflow, electronic medical record streamlining, reducing the inbox volume and like the amount of clicks that you need to put in an order. All of these things really make a difference for physicians and nurses. Maybe addressing, we call it the pebbles in your shoe. So these little things that are happening throughout the day that are annoying or getting in your way of being able to be productive, if we can take care of those one at a time, then all of a sudden you have the space and the bandwidth to deal with even bigger problems on the front line. So that's another area to look at.
Yes, I just spoke with a, recently the podcast on Just Ask Evie, with Dr. Tyler. We had the click of the button to get EMR support. Just doing that can make such a difference.
Yes, absolutely. Absolutely. And, really looking at your clinical workflow, I know that one of the consultants I know pretty well is Dr. Paul Deschamps, and he uses lean management, but he adds in a humanistic approach to that. And one of the interventions that he has found to be very successful has been creating a daily team huddle on the front line. And it's maybe 5 or 10 minutes at the beginning of your day, but it's having management sit in with everyone on the front line and just looking at what resources you have that day. If you have a nurse that's out sick, you've got a doctor leaving early, maybe looking at the patient load and deciding what you can truly handle with quality of care. And so those daily huddles help to rebuild trust, especially if there is some leadership training woven in throughout that.
Yep, I love the fact that you're bringing in culture here, because if we don't have the trust in the culture and people discount it, but it seems so easy to do, but it's not. And it takes work, right?
Mhm.
And it's learning how to get your leaders to succeed. So if you're the head honcho, helping to give the resources to your leaders and middle management people so that
Mhm.
they can go out and do the things that that needs to be done.
Mhm.
So thank you so much. These are so good.
Well,
Um,
thank you, Elsie. And one of the things I want to touch on is that, you know, one of the things I love about your lead physician program is that you blend both personal and professional development. I think that is really key because we don't have that in training in medical school or even nursing school. We don't learn these basic leadership skills. And so we don't know how to really advocate for ourselves when we're on the front line.
that's so true, and thank you for saying that. Yes, it's not just about learning the logistics of leadership, and we could sit there and learn lean management, and we can learn about Cotter's model, of driving change. But if we don't know how to be self-aware and have that emotional intelligence and learn how to drive goals and dream bigger, we're not going to be able to show up as great leaders. Thank you for bringing that up.
Thank you, Elsie.
So how can people reach out to you? Because I know you have this Hope for Healthcare podcast. First of all, before we end this, why did you bring Hope for Healthcare, and what is your big why, and what's your big goal with Hope for podcast? Hope for Healthcare podcast.
Well, yeah, Elsie, as a physician that suffered burnout myself for many years, I almost left healthcare, honestly. And then I started working with you and I started to get inspired again. And when I attended the Burnout Symposium in January of this year, it really highlighted for me how many solutions are available and what these organizations are doing to shift their culture of medicine. And doctors and nurses don't know about this, and there are so many resources available. So that's why I decided to launch my podcast, to help educate and inform and inspire healthcare leaders to implement these innovative, data-driven strategies to resolve burnout.
I love that you're bringing the solutions to the front line and bringing the leaders in the field. And I see you already networking with giants in the field. Can you talk about what's coming up? I know you have an events page on your web. If you guys are interested, go to the events section of her website, and her website is drkatiecole.com. Is that correct?
Yes, that's correct.
Yeah. So tell us about what is the event that's coming up that we should all know about?
Well, I'm really excited, Elsie. We have a National Burnout Symposium. It's a follow-up to the one we had in January. It's going to be in New York, June 23rd through June 24th. And it's really going to be highlighting some of our national experts and leaders on what they are doing that is innovative within their own organization to resolve burnout. So it's very solution focused. We even have a CEO panel that will be moderated by Dr. Tina Shaw. We have some great people coming to speak. Dr. Krasinski, she's been instrumental through the AMA Steps Forward and National Academy of Medicine Roadmap for Organizational Wellbeing. Dr. Paul Deschamps will be co-chairing as well. And he is one of the lead consultants in lean management. And Tim Kaine is a senator from Virginia, and he is going to be opening up our symposium. And, he was really instrumental on the advocacy front with Corey Feist and the Lorna Breen Foundation in getting the Lorna Breen Act passed. And so that's very exciting that he's going to be there. And then we hopefully will have the Surgeon General of the United States, Dr. Murphy.
Wow, that's fantastic. I'm so amazed and all the things that you've accomplished in such a short period of time, Katie. Like you have an extreme amount of talent that you're uncovering, and I see it in I see what you're doing as a great physician leader, and I hope that for many physicians out there who are listening, I hope you're inspired by her story and what she's doing. So how else can people reach out to you? I have your website here.
Yes,
Katie, Dr.
they
Katie.
can reach out to me on my website. They can also email me. They can call me, text me. I'm on LinkedIn. I'm on Twitter and YouTube. I have a weekly podcast, and so that is getting uploaded on my YouTube channel. You can also follow my podcast on my website.
Yes. So info at drkatiecole.com is her email. Thank you so much for that. Thank you everybody for listening. My name is Dr. Elsie Coe. If you have a story in physician leadership, please reach out to me at info at drlccoe.com. And if you're interested in leadership training, we are going to begin the training in August. Go reach out and touch base, leadphysician.org. Any last words of wisdom for us, Katie, as we close here?
I want the message to be very clear that it doesn't matter where you are in the healthcare continuum, whether you're a healthcare stakeholder, leader, board member, patient, physician, nurse, leader, that there is hope for our healthcare system in shifting our culture of medicine. We do have data-based solutions available. So I just want you all to be aware of that.
Right. And I have a comment here. Thank you so much, Dr. Lawrence Counts, for bringing this up. And he says that I'm CMO. I would like to get this information, the resources. My organization would benefit this greatly. And he needs other in the C-suite members realize what I see when rounding and to aggressively hire new providers to ease the workflow. I love that. And he agrees that the culture is key. So thank you for commenting on that, Dr. Counts.
Thank you.
Well, thank you everybody for listening. Until next week, please come and if the more you share and like this the more we're going to be more powerful in getting the word out. Thank you, everybody, for listening. And